Hello everyone, welcome back to our final session on mastitis. We have been talking about the epidemiology of mastitis, how we can have a very realistic and simplified look into the outbreak or occurrence of mastitis in an organized farm or uh, in a smaller area of an administrative block, and we found that mastitis can be broadly classified into environmental mastitis and contagious mastitis. And when it comes down to the pathology or the clinical aspect of individual cases, it can be the clinical case can be classified into three compartments, that is the abnormal milk, abnormal udder, and the abnormal cow. And so based on if the nature is environmental or contagious, we have seen that there are specific pathogens for that causes environmental mastitis and contagious mastitis, and we also saw what are the treatment strategies to be applied to treat bovine mastitis in an area or in a farm. And we found that how easy it is to cure with some cases, and how difficult it will be in with respect to some other etiological agents like Staphylococcus aureus. So that was in a nutshell about what we were discussing in our past three videos. So today we will be trying to complete the or round up all these things. And as we know, we are learning preventive medicine, and the aim is always to prevent the occurrence rather than going in for a treatment situation where we have to treat the animal, because it involves a lot of burden and lot of economic impact onto the farmer as well as the public. So today we will be focusing on the control, or we will be concluding this series with control of bovine mastitis. Now please keep in mind that we have not touched in detail about the organisms that cause contagious mastitis, or the dynamics of infection caused by Staphylococcus aureus, or the organisms and its dynamics that cause environmental mastitis or E. coli. So I strongly recommend that you read about those infections for a wider or a deeper understanding of mastitis. Then there is fungal mastitis. So fungal mastitis happens as a result of a very chronic aggressive and relentless therapy of mastitis with antibiotics. So what happens is that the niche occupied by the bacteria loses, and gradually fungi and yeast take up their places and cause recurrent mastitis in such animals, and the further treatment results in a very poor prognosis in such cases. So these are other minor aspects of mastitis that you need to discover by yourself. Then of course there is mastitis of goats, especially gangrenous mastitis caused by different strains of Staphylococcus aureus again. So the point in goat mastitis is that the general line of treatment and all are same, but it is the microbiology of the etiology that causes more deranged results of running in or that causes serious threat to the animal's life. So I think since you know all the basics, you can easily read and fill up your these gaps of knowledge that I have created. So that is regarding what we were talking about and what we are planning to do. Now we will come to the control of mastitis. So how can we control, or why is control of mastitis happening in our current scenario or all over the world? Now when we talk about control of mastitis, there have been a lot of control policies, and studies have shown that these control measures are effective and very effective, but the thing is that the farmers are more reluctant to adopt to these control policies. So, integrated mastitis control program has been applied on many nations where the milk production has been industrialized, and where the quality of milk is seriously evaluated. And this integrated approach of mastitis or integrated mastitis control programs have brought down the somatic cell count of bulk tank somatic cell counts to less than 4 lakhs per ml, and rate of clinical mastitis to 7 to 21 per 100 cow per year. Now, when all these programs have been focused on controlling the episodes of contagious mastitis, and it is also noted that when the menace of contagious mastitis comes down, there is a the rate of occurrence of environmental mastitis more or less remains the same. Now, the studies have also shown that integrated mastitis control program has a cost benefit ratio of 1:6. That means if you put in 1 rupee for your integrated mastitis control program, the returns will be 6 rupees per, as the improved quality of milk, the volume of milk increases, you can further make downstream processes with the milk, and the cost of the treatment also comes down. So, integrated mastitis control program is very effective, and it has proven that it is very effective in various countries that have implemented the system. But there are certain factors that makes the farmer reluctant to adopt to this method because of the increased labor involved. The farmer may have to change his routine of operations, especially in an organized dairy farm. The farmer may have to change his routine of operations. He has to do additional training, he has to undergo or implement more facilities, he has to improve the infrastructure of the farm, and also there is a amount of reluctance in farmer side to adopt to this integrated control programs, but these programs have been proven to be effective and profitable also, and many countries have been adopting this also. So, what are the components of an integrated mastitis control program? First of all, the farmer should be willing. So, he should be willing, he should be proactive in the ways like he should be willing to invest onto his farm, and also he has to set the goals for improved quality and quantity of milk production. Then there should be a capable lab support to the integrated mastitis control program, like we have to know the etiology, we have to know the somatic cell count status. So, lot of laboratory works are needed, and there should be a lab support. The role of an enthusiastic and a knowledgeable veterinarian is paramount. So, he is the person who has to coordinate between the farmers, between the laboratory technicians, the dairy industry. So, all these things are coordinated, and a very knowledgeable and an enthusiastic veterinarian has to be at the hem of the affairs. Record keeping systems are very important. We will be coming about this in detail in later. Then there should be a proper machinery, milking machinery, and housing also should be proper. All these details will be coming up in this session shortly. Okay, now what can we do about the problem of mastitis, be it in a farm or be it in a small panchayat? So, there are, as we know, we have two major options. Either we can go for an eradication program, or we can just try to decrease the rate of infection. So, what about eradication? Is eradication of mastitis possible? It is not possible. It is an impracticable scenario. Exception may be Streptococcus agalactiae, where it gives where it can have like 80 to 95% of cure rate. Other organisms, it is very difficult because of the complicated dynamics, the constant exposure to various environmental factors that cannot be controlled and all. So, it is rather impracticable to go for an option of eradication, but we can definitely decrease the rate of infection. Now, how low we can go? So the limitation will be the cost effectiveness. So we can, the farmer and the veterinarian and the whole system can, there is a limit to which you can invest, you can bring down the somatic cell count, you can improve the milk production, but after a certain point, the how much you invest into the system, you may not get a satisfactorily improved milk quantity or quality. So that is the limit up to which we can go for controlling bovine mastitis. So you can bring down, as I told you, to bring down the somatic cell count to less than 4 lakh or up to 1 lakh. But if we go beyond or below this thing, or a very unrealistically low somatic cell count, then again problems will begin to crop up, because you have to understand that the role of somatic cell count is to protect the udder from infection. So when you bring down or put on a very aggressive mastitis control program, and the somatic cell count goes below goes down really low, then your udder again becomes exposed, or becomes exposed to more infections, and there will be a higher possibility of occurrence of clinical mastitis. So retrieving non-pathogenic organisms and reasonably good level of somatic cell counts, like between 1 to 4 lakhs, is considered as an okay value for when it comes to controlling assessing the milk quality. Now, how can we implement a mastitis control program? We can do it by two ways. Either we can put up laws and enforce these laws, so that everybody in the dairy production sector complies, and the others can be penalized. So that is known as, or that is by putting up laws or legislation. So you can go for a legislation method, where you have to control it with an iron fist, or it can be a voluntary approach, where the farmers are made aware of importance of good quality milk and good quality production systems, and the farmers themselves take up the control measures to reduce the incidence of mastitis in their farms. So most of the countries do this voluntary method of mastitis control, whereas a very few countries have this legislative methods to control also. So they restrict the somatic cell count, they have restrictions, they have standard procedures for treating mastitis and all. But to impose something on general public is always considered, is given thought in detail in most of the societies. So the ideal method for our country would be to make the public or the dairy sector aware of the importance of controlling mastitis, and then go for a voluntary mastitis control program. So that has been what is happening in our place also. Now let us see the principles of a mastitis control program. So what are the dynamics of mastitis in a area or in a farm? So you can say that the prevalence of mastitis is a function of new infections minus the rate of infections. So what is the quantity of mastitis in your area? It will be dependent upon the number of new infections minus how fast you are eliminating mastitis cases in your area. Now rate of infection can be a function of the level of exposure, and it is multiplied by the number of susceptible quarters. So as the susceptible quarters increases, the risk of occurrence increases, and that is further fueled by the level of exposure. Or level of exposure, of course, it includes many things, like the environmental hygiene, the milking machine, the milker's hand, everything. So all these contribute to the level of exposure and the number of susceptible quarters, and it will be a product of these two or a function of these two that determines the rate of infection. And what about rate of elimination? Rate of elimination is a function of the number of infection multiplied by the efficiency of treatment and spontaneous cure. So for mastitis to be eliminated, either very rarely it can be a spontaneous cure, and you can your treatment should be very efficient so that the organism is completely excluded from the this thing. Now, how aggressive you are or how well you are treating or depends upon the rate of elimination also. So your treatment may be good, but if the infection pressure is very high, your rate of elimination comes down. So that is why it is said that it is a function of number of infection into the addition of efficiency of treatment and spontaneous cure. So if we plot the whole dynamics of mastitis into these three simple equations, things may be very easy. So you have to increase the rate of elimination, decrease the rate of new infection to reduce the prevalence of mastitis. It can be easily said and done there, but the relationship and this dynamics is very complex because there are a lot of variables involved. Because rate of infection, new infection, it starts from the environment of the animal and the management practice, the age of the animal, the udder of the animal, the etiology involved. So you find that each of these functions, each of these operators will have a large number of variables, and that makes control of mastitis a really complex subject. Now, what are the basic, what is the basic idea of implementing a mastitis control program? So how can, when someone asks you how can you control mastitis in your place, your answer or should depend or should be placed strongly on the three pillars of basics of control. That is, first you have to eliminate the existing infections, you have to prevent the new infection. So what are the programs that you plan to eliminate the already present infections in your area or in your farm? Then what are the ways to prevent new infections from occurring in your farm? And finally, in between eliminating and preventing, you have to regularly monitor the health status of the udder of your animals. So these are the three pillars on which a strong mastitis control program stands. Now, when we examine these things, so how can you eliminate the current existing infection? You have to go for treatment so that the bacteria present in the udder are killed off. So there are two methods to do. Either you can go for treatment during lactation, or you can go for treatment during dry period. And if both of these methods are not helping in your eliminating, you have to cull the cow. So culling, dry cow therapy and lactational therapy are the basics of controlling, eliminating new infections of mastitis. Now, dry cow therapy, as in the last class I have told you, it has been scientifically proven to be a very important tool to control contagious bovine mastitis. You know the reasons also. Now, what about treatment during lactation? Treatment during lactation can be variable because of the predilection where the bacteria occurs. So if it is the abnormal milk, it will be easy, you can go for an intramammary therapy. If it is the abnormal cow, you may have to go for a parenteral therapy. But if the organism is in the udder, or if the udder is abnormal, then a lactational therapy can be not fruitful as you expect in case of mastitis. So that happens during lactational therapy. So that is how you have to, your focus is to eliminate the infection. Then what about preventing new infection? Preventing new infection is basically from hygiene. So you have to go for treat dipping, you have to go for regular checkup and maintenance of the milking machine, you have to disinfect the liners. Then again you can go for dry cow therapy because it will prevent new infections during dry period, early lactation, late dry period, etc. And use an internal teat sealant. Then there is another method that has been said, that is to use bovine granulocyte colony stimulating factor. What happens is that it will improve the neutrophil count in the blood, that will improve the immunity of the udder, and thereby reduce the chance of occurrence of mastitis during the late dry period or early lactation stages. So that is how you prevent new infection. And what about monitoring of udder health? Udder health, you have to, so once you have started trying to eliminate the infection and started preventing new infections, you have to regularly monitor the udder health, see how your you have to see how your project is in progress. So is the number of mastitis cases decreasing, is the number of somatic cell counts decreasing, is the how many healthy udders were there before you started the program, how many are there now, and how many you have to have why at this period, at this much period since the implementation of the program. So that is how you evaluate the progress. There are many methods, as you see, as we have seen in the diagnosis session, and all these are analyzed and put up and used in decision making system, and based on these decisions, people put up their premium costs or penalty costs, because you can see that the milk has slowly, you can see the quality of milk will improve, and you will be getting premium. So when the quality goes down, you will have to pay penalty, or the profit rate is reduced. So that is how you monitor the udder health. So based on all these principles, dynamics and basics, the mastitis control program has been implemented, and there has been lot of studies since the 1970s. These have been implemented. So initially they had come up with this 5-point mastitis control program. So 5-point mastitis control program, the 5 points are to look into the udder hygiene and proper milking, then installation, functioning and maintenance of milking equipments, dry cow therapy and management, appropriate therapy during lactation, and culling of chronic cases. Now this had a very good impact in the dairy industry of European and American countries, but as you can see, this focuses on the hygiene, the dry cow therapy and the culling of chronic cases. So now that this focuses primarily on contagious mastitis but not environmental mastitis. So what they could see was that even though their rate of clinical mastitis and the rate of contagious mastitis was coming down, there is no improvement with regard to environmental mastitis. So they put another additional 5 points as in their control program, and the 5-point mastitis program became a 10-point mastitis program with addition of these 5 points. Those are maintenance of appropriate environment, good record keeping, monitoring the health status, periodic review of the udder health program, and goal setting. So this considers the environment also, and thus the current 10-point mastitis program is implemented in all the major countries to control the incidence of mastitis in their farms or territories or whatever. Okay, so it is not that you have to implement this by letter and by word. It is not like that. So it takes a lot of experience, it takes a lot of insight to implement a mastitis control program in a local body like a panchayat, because it is not like an organized dairy farm, but it has certain characteristics that if you are that your insights or your experience will help you to understand, and you have to adapt to this policies and modify these policies suitably, so that you can achieve a reasonably good level of mastitis control in your unorganized sector. So let us see in detail what are the 10 points of mastitis control in a 10-point mastitis control program. So udder hygiene and proper milking method. What are the pre-milking preparations needed? Pre-milking preparations, so you have to ensure, the farmer or veterinarian should have to ensure a regular schedule, and the environment should be stress free, and ensure that the teats and the udder are dry and clean before milking. So it is not about the cleanliness alone, the teat and the udder should be dry also, because the presence of moisture or fat particles can cause the increase the presence of contagious organisms or teat skin opportunists to access into the mammary gland. So preparations for milking: first you have to wash and then you have to dry. Now for drying, you cannot use the same towel for all the animals in a farm. So it has to be individual. So you have to get individual towels, and in some farms and some people use a germicide to wipe down the udder before milking. So this is known as pre-dipping. So pre-dipping is a good practice, but not all do. So you can apply germicides, and then again you have to pat the this thing dry. So usually iodophos are used, that is povidone iodine can be used, and that will help in controlling environmental pathogens like streptococcus euboris and all. Then you have to check for the form milk or the udder for presence of mastitis before milking. So you have to examine the udder and do the fore stripping or the strip cup test. And strip cup test is very important in controlling mastitis, because that gives the first sign of developing clinical mastitis. So other than that, when you are doing this fore stripping, when you strip down the milk, it will flush out the pathogen, it will reduce the contamination with the pre-dipped germicides, and also it will stimulate letting down of the milk. So once you do this checking of fore milk, then milk let down is stimulated, and then you have to go for a very efficient removal of milk, because retention of milk in the udder is one important factor that causes mastitis. So the milk removal mechanism, be it hand milking, be it machine milking, it has to be very efficient and as efficient as possible. So when you are doing machine milking, you have to attach the unit within 90 seconds, because by that time it is concerned with the letting down period, and milk, the unit should be attached within 1.5 minutes. There should not be any liner slips or machine slipping. So because liner slip or if those are defects while milking machines are being operated. So if liner slips or machine stripping happens, there is possibility that drawn milk from the udder may be propelled back into the udder itself. So there will be contamination in the udder. Then you should not over milk the animal, and the vacuum, you should not remove the milking machine while it is in vacuum. So you have to release the vacuum first, then only you shall take off the milking machine or the claw. Then another very important thing is the post milking disinfection. Post milking disinfection is the most effective practice in preventing contagious mastitis in cows. So there are a lot of products available. You can go for iodophos, you can go for chlorhexidine, then there are quaternary ammonium compound, sodium hypochlorite, then there are barrier dips. So iodophos, it should be like a minimum 0.5% that is to be applied on the udder, minimum 0.5%, and these iodophos form the gold standard for comparing other germicides. Chlorhexidine, again very important, very efficient germicide, and the peculiarity is that it can even function in the presence of organic compounds, whereas quaternary ammonium compounds are not that efficient, but they are safe and effective. Sodium hypochlorite is the cheapest udder disinfectant available, and you can use your regular laundry bleach. You can cheaply and easily get laundry bleach, and you can dilute it to a final concentration of 4%, and you can use it. So some farmers do that. Then there are barrier dips. So barrier dips can be chemicals like latex or acrylic. So along with the disinfectant, they dip with the latex or acrylic, so that it will form a permanent barrier, a coating around the teeth, and leave it there. So next day, when or in the during the next milking, only problem is that you have to rub off this barrier sealant and start milking. So it is not very popular, but it is available. Then coming to the use or how to use, so you can dip them or spray them, and it should cover as much as area as possible, and it should not be diluted. So it, many the one problem with this using of iodophores again in our place is that farmers tend to dilute because of the cost involved. So when you dilute it, the function or the efficiency of germicidal action drops, and it cannot be used, or it is better not used. Also, once after dipping, you should not put the remainder of the agent back into the original bottle. Then you have to give appropriate contact time, so you have to give 1 or 2 minutes at least, some needing 5 minutes. So give the appropriate contact time, then only it should be wiped dry. Now another important thing is to disinfect the teeth liners. So teeth liner should be disinfected regularly. So the teeth liner or the milking machine itself comes with the disinfectant solution also. They have recommended methods of liner disinfection, and that has to be followed. Then there is implementation of a segregation program as a part of this point, that is udder hygiene. So the segregation says that the first lactation cows should be milked first, because they have the least probability of having contagious mastitis or subclinical mastitis. High somatic cell count cows, the high chronic cases, clinical mastitis cases should be milked in the end. So that is the segregation program.